Hi, this is Dr. Blied, and I'm going to lead you through an ABC worksheet. This is a tool that's often used in cognitive behavioral therapy to help us be able to identify and recognize the relationship between what happens in our lives and the thoughts that we have and our emotions that flare up so that we can be able to challenge any stinking thinking or any thoughts that are unhelpful and really lower the intensity of our emotions that flare up and the duration of how long the situation is bothering us. Okay, so it's ABC worksheet, and I'll explain what each of those are. But I need you to get your journal or something to write with and your pen, and we'll get started. So go ahead and press pause if you need to. Okay, welcome back. So what I'd like you to do is draw 3 boxes at the top of your page. And under one box is A, on top, and on top of the second box is B, and on top of the third box is C. I'm going to get a piece of paper and write it down as well. So just to be able to give you an example. So you have a blank sheet of paper, 3 boxes at the top, A, B, and C. Okay? So under A, you're going to write, the A is the antecedent or the activating event, and it's basically what happened, right? So what is the situation that happened that caused you to have anger or frustration or sadness or joy, whatever the case might be? What is the activating event? Okay. And then B is the belief. What is it that you told yourself? What is the thought that swirled through your mind when that event happened? I'm writing it down. And C is the consequence. So what showed up in your body, what showed up in your emotions, how did you feel about the situation? How intense was it? What was the consequence to the situation and the thoughts that you had? Okay. So ABC, the activating event, the belief, what you told yourself, and then the C, the consequence, which includes your feelings, your emotions. All right, so I'm just going to give an example. Activating event. I sent a text to a friend and they didn't respond. We both have iPhones, and so I could see that she read my message. I can see it was delivered in red, but there was no response. Okay, B, what did I tell myself? Maybe I told myself, I'm wondering, like, is this person really my friend? Did I do something wrong or to offend them? Are they not talking to me right now? I'm really questioning our friendship and maybe questioning my value. And if that's the case, if that's what I'm telling myself, that, I am being ignored on purpose, then how does that show up? And C, consequence, how does that show up in my emotions? I'm going to feel maybe embarrassed that I reached out and, didn't get a response. I might feel rejected. What else? But apply this to your own situation. Okay. Next, I want you to examine what you put in column B, because as I shared in other videos about cognitive behavioral therapy, where we really have the interception is with our thoughts, what we're telling ourselves. So take that thought of, my friend doesn't like me, I'm being ignored, and ask yourself these 2 questions. Number 1 is, how realistic is this thought? I'm writing it down. How realistic is this thought? 0 to 100%, okay? How realistic is this thought? And the second question is, how helpful is this thought? So asking yourself those two questions. Okay. How realistic is this thought? How helpful is this thought? Go ahead and screenshot this image if you want to reference it later. How realistic is it and how helpful is it? How realistic is it that I'm being ignored and this person isn't really my friend? I mean, yes, I am being ignored, but you know, like, is it on purpose? Maybe not. You know, there's some other possible explanations. And how helpful is it? You know, although it's a little bit realistic, I don't know how helpful it is, like, for me to think this. Like, it's definitely not helping my day because I'm stressed out and I'm thinking about possibilities instead of minding my business and trying to take care of me and maintain my peace of mind. So it's not really helpful. Okay. So here's the next step. After you answer those two questions, I want you to answer the next question. If you cannot, without a doubt, 100% say yes to both of those questions. Like, yes, this is very realistic, 100%, and yes, this is helpful, 100%. If you can't say it without a shadow of a doubt, then go to the next step, which is, what can I tell myself differently in the future? Ask yourself that question. Now we're starting to generate possibilities. We're starting to, it's called cognitive restructuring and cognitive reframing, which basically means there's a different way that I can look at this situation that's going to be more helpful for me and for my peace of mind and more realistic for the situation. So that next question is, what can I tell myself differently in the future? AKA, what else could be true? So it could be that my friend saw my message, but was in a rush doing something else and just forgot to respond. Or maybe they're actually sick and not feeling good. Or maybe they were driving and they don't need to be texting back at that moment anyway. Okay, so what else could be true? This is going to help so much with your anxiety symptoms, with your depression symptoms, so you can get out of your own head and get out of your own way. Of course, not this alone, but in combination with the other work that you're doing, with the other tools through the Faces of Health app, with your work with your therapist, and the medications that you're taking. It's all important pieces of the puzzle that we all put together, okay? Tell me how this works out for you. Write about it in the forum, in the community.